Just listen to this man. He got some good news for you. Hey, man, listen. Hey, everybody, gather near. The doctor's in the house, so lend him your ear. The things he can say might even make your day. He might even help your pain go away. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house.
Oh, yeah, ladies and gentlemen, the doctor is in the house, bringing you episode 600. And today, my wellness warriors, as you take care of your health, become a wellness warrior and get rid of your cognitive dissonance where you feel uncomfortable when confronted with evidence that contradicts your beliefs. We are going to talk today in a summary fashion about the cholesterol myth and why low levels might be bad for you. And remember, in a world where medical error is one of the leading causes of death, please stay a wellness warrior, do your own research, and join the thousands of listeners on a journey to better health at Dr. Ron, unfiltered, uncensored. Remember, modern medicine has one goal, keep in business. And the business model is simple. If they cured anything, they'd lose customers. But if they ignore the diseases and merely treat the symptoms, eventually they will have most of the population of the world over 40. And as Robert Kennedy has pointed out, most people over 65 have chronic diseases and take at least 5 medications, some of which are just for the side effects of the first ones that were ever prescribed. So, welcome. We're going to dive into this topic, which really is misunderstood, and it is about cholesterol. We have been told for decades that lower cholesterol is better. But what if that isn't the complete and full story? What if instead of protecting us, low cholesterol levels are actually putting our health at risk? So today we will discuss the dangers of low cholesterol, why your body depends on it, and the latest research revealing cholesterol's surprising role in fighting cancer. So please stay with us I think it will be an eye-opening discussion. So cholesterol is essential. Let's start with the basics. Cholesterol is not the villain. It's made out to be. It's actually essential for life. Your body uses cholesterol to produce hormones like testosterone, estrogen, cortisol. Without it, your body simply would not function properly. Your brain is about 60% fat, and cholesterol plays a crucial role in memory, learning, and overall cognitive function. We touched on this in our dementia series. It's also a building block for vitamin D and bile acids and aids in digestion. Vitamin D depends on cholesterol. Studies have linked low cholesterol to an increased risk of depression, an increased risk of anxiety, and even a higher mortality rate. So, if cholesterol is so essential, why are we constantly told to lower it? So let's talk about this topic. What happens when cholesterol levels are too low? In medical school, I had a professor who said, when you go out into practice, if it's low, higher it. If it's high, lower it. And that is exactly what they've done here with this essential nutrient. So, we often hear about the dangers of high cholesterol, but really, we do not hear much about the risks of low cholesterol. But I'm telling you, research shows that very low cholesterol levels can actually increase the risk of cognitive decline, dementia, and neurodegenerative diseases. Those neurodegenerative diseases includes Parkinson's. Low cholesterol is associated with a weakened immune function and higher infection rates. Some studies suggest a link between low cholesterol and an increased risk of certain cancers. And all that does is highlight its protective role in our bodies. Lower cholesterol levels have even been associated with an increased risk of violent behavior and suicide. That's right. Cholesterol plays a role in mood regulation as well. It's involved in neurotransmitter functions. And when levels are too low, it can impact mental health. So, in an article recently published, cholesterol is needed to prevent aggression. And we just talked about that. It's needed to fight cancer. It's needed to prevent hemorrhagic stroke. It's needed for your memory. Our next segment will be about statin-induced memory impairment. Cholesterol is needed for longevity because it helps to keep our telomere long. This definitely is where size matters. The longer the telomere, the longer you live. And cholesterol, by helping our immune system, helps us fight infection. So let's talk a little bit about the cholesterol statin controversy, or the cholesterol derangement syndrome. It's one of the biggest health debates. Statins are among the most prescribed drugs in the world, but are they always necessary? Many patients are told to lower cholesterol without considering the risk of going too low. Statins deplete coenzyme Q10, which is an essential enzyme for energy production, which can lead to muscle pain, weakness, and fatigue. And again goes back to why I've asked you to be a mitochondriac. It affects the mitochondria, the powerhouses of the cell, the powerhouses that give you energy. New research is challenging the idea that lowering cholesterol prevents heart disease in all cases. Heart disease, in spite of the billions of dollars on statins that have been spent, is still the number one cause of death. For some people, statins may be helpful, however, but for others, they may be causing more harm than good. It's always important to ask questions and understand the full picture before making any decisions. Go back and listen to some of the podcasts, mine or others, on statins that goes into how they can cause diabetes, glaucoma, dementia. It's actually really incredible. Let me just see for 1 second. I had a note here. Yeah, the cholesterol is just essential for all animal life, and each cell is capable of synthesizing it from simpler molecules. And here, what I was looking for is this statistic. It should not be surprising, ladies and gentlemen, that cholesterol-lowering drugs have over 300 adverse health effects associated with them. And it's about time we get back to physiology and basic biology. Now, did you know that cholesterol is a cancer fighter? Here's something you may not even heard about. Cholesterol can actually help fight cancer. Emerging studies suggest that cholesterol supports the immune function and plays a role in cellular repair. Remember to have a superior interior to keep your immune system functioning properly. The body uses cholesterol to repair and maintain cellular integrity, and that is one of the factors. In fact, it's a key factor in preventing mutations and disease progression. Some research suggests that low cholesterol is linked to increased mortality in certain cancer patients. So it might be a marker that if your cholesterol is too low, it's not a good sign for your mortality risk. So while we've been told to fear cholesterol, it might actually be helping to protect us. So cholesterol can actually have many, many good effects on our body. And just because it's high, we don't want to lower it. And it's really important to know that cholesterol may boost our immune system's ability to fight infections and certain tumors. And I'm not just making this up. This was a study from the Icahn School of Medicine at Mount Sinai in New York. That study revealed that cholesterol plays a crucial role in the function of certain cells called dendritic cells, the immune cells that help the body recognize and fight cancer. And cholesterol fuels these immune cells, ladies and gentlemen. So not to be demonized on itself just because it's high. And what is high now was not high when I was in school. Granted, I'll give you that was a few years ago. A few years ago, it was 200 plus your age would be normal because as you age, your body needs that cholesterol. Your brain needs that cholesterol. So what do we do about it? Well, we want to maintain a healthy cholesterol, an optimal cholesterol, not a so-called normal. In fact, as we age, we should always aim for optimal of everything, optimal hormone levels, optimal thyroid levels, optimal cholesterol levels, which means we get out of the paradigm of just looking at these fancy charts that the lab companies give us that show you low, high, and normal. Well, we want to be optimal. We want to know what does a 30-year-old's cholesterol look like? What does a 30-year-old's testosterone, estrogen look like? So instead of focusing on lowering cholesterol, we should focus on balancing it through what we talk about always is diet and lifestyle changes. And again, we come back to what was brought up during the hearings for Robert Kennedy, avoiding processed and ultra-processed foods, avoiding the seed oils, which are highly unsaturated and oxidized, avoiding sugars. Instead, we should try to focus on eating whole foods, healthy fats, like eggs, like butter, like olive oil, and omega-3 fatty acids. Strength training. We did a program a few weeks ago that's showing that, training your muscles actually helps you to live longer. Regular movement. All this supports metabolic health and helps to balance your lipid levels. And we go back to prioritizing our sleep. We talked about this last week, how, get rid of that blue light a couple hours before you go to bed. When you do sleep, it's preferable that you sleep on your side. Left is the best. Right will be okay also, unless you have reflux. Try to sleep in a dark room. Manage your stress. And get exposure to natural sunlight so you can have healthy cholesterol levels. And remember, people that avoid the sun have the same mortality as someone that smokes 2 packs of cigarettes per day. Wow. Did I really say that? Yes, I did. I backed it up a couple weeks ago with another podcast. Olive oil, avocado, fatty fish, nuts, all good cholesterol. And that processed and ultra-processed foods and fried foods, they can really give you a bad type of cholesterol. Cholesterol is okay until it's oxidized. Once it's oxidized, it becomes bad and lowers your good cholesterol levels. So what's oxidized cholesterol? Think of eating a fried egg versus a scrambled egg. When you scramble the egg, a lot of oxygen is mixed in with that egg. That is less healthy than a fried egg or a soft-boiled egg. Get the idea? So the cholesterol narrative, thankful to say, is shifting, and it's time we rethink outdated advice. Low cholesterol is not always healthy, and maintaining optimal levels is crucial for brain function. It's crucial for immunity, and when we have a strong immune system, we can fight cancer and we can prevent cancer. If you're on statins, ask some questions about them and get an understanding of the full picture. I would just remind you that they used a false statistical method to make statins look good. They used relative risk rather than absolute risk, and it made them look a lot more effective. I don't have the exact statistic, but I think a person would have to take them for 2 to 3 years to get an extra 1 or 2 days of life. But how about all the side effects from the statins? So, ladies and gentlemen, thank you for tuning in to Dr. Ron, Unfiltered, Uncensored. Be sure to subscribe on Podbean or any other of your podcast apps. And let's keep this conversation going. Doc Ron Radio is Doc Ron Radio at Gmail is the email address. You can get Doc Ron Unfiltered on WordPress now if you don't want to listen to it and just get the summary of podcasts. That would be WordPress. I'll give you the exact address in a second, and it would be Dr. DOCTOR ronradio.wordpress. And you can read the show when it's transcribed. So thanks for tuning in. Subscribe, spread the word, keep the conversation going, stay healthy, stay informed, be well, and God bless. See you next time.
Hey everybody, Dr. Ron's finished for today. I hope you got some good wisdom for what the man had to say. If it's all about good health, he's the man you got to see. He has a lot more answers for you. So tune in next week when the doctor is in the house. Or when the doctor is in the house. And let the doctor know what's bothering you. When the doctor is in the house. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. I'm sure he can tell you just what to do. The doctor is in the house. The doctor is in the house. Let the doctor know what's bothering you. When the doctor is in the house. So if you have a pain, call the doctor. If you have a strain, call the doctor. Let the doctor know what's bothering you. When the doctor is in the house.